Okay, I'm Dr. Betita, and I've been tasked to lecture on review of medical literature, its methods, importance, and best practices. So by the end of this lecture, you should be able to define the purpose of a medical literature review, identify the different types of literature reviews, apply systematic search strategies, critically appraise medical literature, and use proper referencing technique. What is medical literature review? So this is a summary and synthesis of existing research on a specific topic. It helps identify gaps, conflicts, and consensus in a particular field, and its purpose is to support evidence-based medicine, guide clinical practice and policy, and inform future research directions. The types of literature review are as follows. So narrative review. This has broad overview and no strict methodology. Essentially, this is a narrative, which means storytelling. You are basically narrating the similarities and differences between different studies without any regard for any particular protocol or methodology in this review. A systematic review, on the other hand, is rigorous and protocol driven. And for systematic reviews, we primarily use PRISMA guidelines. Your meta analysis involves statistical pooling of study results. So you combine several different studies statistically in order to generate a much larger picture of a particular phenomenon. Scoping review, on the other hand, simply maps out key concepts and evidence gaps. Okay, so the steps in conducting a literature review are as follows. First, you need to define the research question. PICO, when you are dealing with experimental studies, and PEO when you're dealing with analytical studies. PICO, population, intervention, comparison, and outcome. And PEO, your population, exposure, and outcome. Your search strategy involves looking through databases, applying keywords and Boolean operators. Screen and select studies, using inclusion and exclusion criteria, extract and synthesize the data, and finally, you critically appraise. So those are the 5 steps in conducting a literature review. So again, first, you need to define the research question. Second, apply a search strategy, looking through databases using keywords and Boolean operators. You screen and select the studies that you have found, applying inclusion and exclusion criteria. You extract and synthesize your data. And finally, you critically appraise your studies, assessing for bias and the quality of the data inside of the study. Formulating a research question, which is the first step, involves identifying a population, intervention, comparison, outcome, or a population, exposure, and outcome. In this particular example, our population is diabetic adults, the intervention is metformin, your comparison is placebo, and your outcome is A1C reduction. And therefore, your question is, among diabetic adults, how effective is metformin at reducing HbA1c than placebo? Okay. The next step is searching the literature. So you need to look through your database. The most commonly used database is PubMed and Medline because this is free and readily accessible. Embase has a paywall. Cochrane Library, this is primarily used for systematic review, and your Scopus. Search tips, try to use mesh terms. These are medical subheadings. Apply Boolean operators like and or not. And both terms must be present in the article, or either term must be present in the article for it to show up, and not you are trying to exclude a particular term from your search. So if the word comes up, then it's not going to come out in your results. And you may limit by study type like RCTs, cohort, etc. Boolean operators. So our Boolean operators are and, or, and not. If you use and, then both terms must be present. So term 1 and term 2. Both terms must be present in order for the article to come up. Or either term may be present in order for it to come up in the results, and not you are excluding a particular term from your results. So if the term comes up, then it will not come up in your search results. Okay. So, and you want to use this if you want to contract your search or to expand and not to exclude a particular term from your search. Okay. Prisma flow diagram. So it begins with identifying studies using database hits. So when you search through the database, may mga lalabas na mga studies. Those hits will form the first part, the first step in your Prisma flow. Then you need to screen the studies that come up by reviewing the title and the abstract. So is this the type of study that would be useful to you? Next, you check for eligibility by reading the full text and looking for the quality of the study and the presence or absence of certain biases that may affect your systematic review. And finally, once you have assessed the quality of the studies that you have obtained, then you include those inside of your systematic review. So critical appraisal involves the following steps. You assess your study quality. For RCTs, we use the Cochrane's risk of bias tool. For observational studies, we use the Newcastle Ottawa scale. And for systematic reviews, we use AmStar 2. Next, we do data extraction and synthesis. So the key elements to extract would be the study design, sample size, and the results, and the strengths and limitations of that study. Then we synthesize using either a narrative summary or meta-analysis if applicable. So meta-analysis, again, is when you are combining several studies statistically in order to get a bigger picture of the results. Narrative summary naman, you are comparing different studies together to assess for similarities and differences. Okay. Common pitfalls in doing a literature review include selection bias, ignoring negative studies, poor search strategy, which leads to missing key papers, lack of critical appraisal, and referencing errors. So some tools to assist would include Rayan, which is a screening tool for systematic reviews, EndNote and Zotero, which are reference managing apps. So you download the PDFs, and this provides a tool for citation, management of notes, and for producing quotes, etc. And the Prisma checklist, which are your reporting guidelines. So in summary, literature reviews are foundational for evidence-based medicine. They use systematic methods, critically appraise all studies, and proper referencing is essential. So these are my references, and thank you for your time.